My name is Ruff, and I'm a clinical neuropsychologist. And in that role, I do three things. I evaluate patients who have neurological disorders by tests and examine to see what their strengths and weaknesses are. I also evaluate their emotional status subsequent to having a neurological disorder. The second thing I'm involved in, I sit across from patients and their families and do individual psychotherapy. And the third part is I'm involved in research, trying to develop new techniques for assessment as well as new techniques for treatment, both from an emotional level as well as a cognitive level. Currently, as part of that research, I'm a consultant at Posit Science Corporation, and typically before patients embark or clients embark on a new program, we try to provide them with some psychological support. All right, one of the tools I'd like to give you is that you learn about expectations and what role that might play when you enter a program. Because if you're anything like me, you will always have expectations about what will happen. I even have expectation when I see my doctor, what he might say and so on, and I think it's very common that we have this in almost all aspects of our life. We have certain expectations. If you go to a party, you have certain expectations. If you entertain at home or whatever. Now going into a program, you're going to have expectations that then what happens in the program, there's a little bit of a battle that can occur between your expectation and what you think is happening. You got to watch out that you don't become enslaved to your expectation, because that can have some negative consequences. So let me give you an example in my own life. Going on vacation, I wanted to do things really well for my family, my kids, and my wife. Now what would happen on occasion, we would lose our luggage and it would rain and it was miserable at times. And I was really sad because in my expectation, the sun was shining, we were sitting on perfect spots, our luggage always arrived on time. And when I got home, I felt like my vacation wasn't quite right. And then I realized I needed to learn to not be enslaved by my expectation, but rather enjoy my vacation as it unfolds, because life is that way. Now, when you come into a program like this, and maybe we tell you that you will improve your memory or something, you might have an expectation of how much you will improve it. And I know people can get disappointed, because when I want to get fixed, I want to get fixed completely. So here we need to kind of work with you so that you have reasonable expectation and adjust them. There's nothing wrong with having expectation, but just adjust them so they don't really start frustrating you. The second tool I would like to provide you is one that separates fact from interpretation, from what is and what we make it mean. Now, there's nothing wrong with interpreting, but sometimes we need to watch out that these interpretations don't really take us off into a direction that causes a lot of pain and suffering. So let me give you some examples. Recently, I had a flat tire. You would agree I had a flat tire. Everybody would agree that I had a flat tire. But I didn't stop there. I started interpreting it. Why did this happen to me? Why on this freeway? Why at night? There's not a gas station close by. And then I caught myself. I just had a flat tire and I'm making this drama out of it. Why don't I look at the bright side, or at least balance it and say, I'm okay, no one got hurt. Sure, I'll have to change the flat tire, but I need to go on. So sometimes these interpretations need to be checked and balanced out. The same thing happens when you enter a program. You have a certain interpretation that you will make when, for example, you fail. In this program, for it to work, sometimes we have to push you up to your highest level of functioning. Now, normally we function well within our mean, but we have to push you up to your threshold. When I get pushed up to my threshold, I start interpreting, why can't I do that? What's wrong with me? And I did a part of this program, and I did well in one and not well in the other, and I thought my old sentences of interpretation, which I'm not smart enough, why can't I do that, came up. Now what's important is that we separate the fact from what's happening. This is a program that I want to do to help myself. And occasionally I will have these interpretations. Let's keep them in check. Let's keep them separated. And let's really follow with the main mission of trying to improve what it is you're trying to improve and not let the interpretation kind of weigh us down unnecessarily. So I've provided you two tools. One is check your expectations and check your interpretations. There's nothing wrong with interpreting. Even the fact that it's good or bad is, of course, an interpretation. But anyway, having these two tools, I sometimes tell my clients that I work with, these are literally like two tools in your toolbox. And I have heard the story that if you only have one tool, like a hammer, everything can start looking like it's a nail, right? So you want to have, when you hang up pictures, you want to have some pliers. You might want to have a measuring tape. You want to bring your tools to the program, and you also want to have the hammer, obviously. So interpretations have been a very important thing that I check. Even in my relationship, I will say, I'm interpreting. I know this happened, but I'm checking in with someone. Is this interpretation correct? And also with my expectations. I check in with my expectations. And so do that throughout the program, and I think you might benefit from that.